look at this and see what's happening. Now, these pesticides are being sprayed by multiple different people. And there's actually a department with our government that is all about pesticides. Yeah, they're called the Vector Department. And they used to have permission to come and spray for the medfly and the mosquitoes and that, but they just lost a court case this year
Yes.
where they can't go and do that so much anymore. So that's one good thing. But we're going to learn more from Tiffany. This is like such a big topic that we have had Tiffany on our show for this is the fourth time, and we're doing like a series here to really kind of get into this because even having one conversation with Tiffany, it is really hard to dig deep, even for Tiffany to be able to talk about this stuff. There's emotion attached with it, pain that she has been through, and just knowing that there's other people there that are still suffering has been, it's just a very hard thing for her to talk about. But this is affecting every single one of us. This department goes out, they spray pesticides, it's drifting onto our homes, we're being exposed and we don't even know about it. And these are some of the worst of the worst poisons in the world that, and don't think that they're not affecting your health. And then think about our most vulnerable, our children, our elderly, our sick. These people are being exposed against their will and they don't even know it many times. So but there's so much more, and we're talking billions of taxpayer dollars that are spent on these vector departments. And they want to justify their existence. They want to keep getting the money. They want to keep doing what they're doing. But should we be allowing this to happen? These are the kind of questions that we should be asking. And Tiffany has been doing an incredible job of giving us the inside information on what goes on in these vector departments so that we can start to answer these questions and then get past that level of not just asking the questions and getting the answers, but then contemplating the next action step that we have to take. And you may have saw like Zika posters. I want to talk about that with Tiffany today too. The big Zika threat that we're hearing about, is that real? We'll get into that a little bit today too. So let me go ahead and introduce our guest, Tiffany Anderson. Hey, Tiffany.
Hi, Elaine. How are you?
I'm doing great. A little bit too hot for me, but
Amen.
you got to get up early in the morning, to get your chores done. That's just the way it is.
I'm getting up at 4. My motto is get up. Let me see. Go to bed before the sun and get up before the sun.
Early to bed, early to rise makes a man healthy, wealthy, and wise.
Yeah, women too.
Yeah, yeah. And I am a 4 o'clock, 5 o'clock in the morning person. It's my favorite time of the day. I'm the most productive in that morning, and it's quiet. I can think. It's nice and cool for the summertime. And
I warn you. I don't know where we're going to go with this conversation. There's just so many places to go, but I have to tell you that this is a time of year, if we were to get up at 4 in the morning, this is the time of year where they take the aerosol trucks and they cold fog. And so they could be potentially spraying in your hometown at 4 a.m. in the morning. So you need to be careful of that.
yes, and so what does that mean? Cold fog.
Cold fog is, I was wondering, like, were we going to get into species of mosquitoes today? Were we going to get into the pesticides that we use? Where would we go today? But we could start
Yeah,
with
I was thinking about that and then get into the Zika because people are starting to see commercials. They're seeing billboards that are warning them about Zika and
don't
having,
believe it.
and having
Don't believe it.
babies. I know. I mean, I've had top scientists on the show, Tiffany, and we cannot find any validation where there has been actually even any research that has been able to prove, and something that a lot of people don't realize, the microcephaly with the weird shaped heads that they were trying to scare everyone with, that happens all the time. 2 to 12 babies in every 10,000 births have microcephaly because there is a long
Probably
list.
side effects of pesticides or side effects of something that men are doing. Men, when I say man, generic, probably a side effect of something that they're doing. It's not.
Well, that's
Uh,
what you got on one of the reasons for it is exposure to a toxic substance. And so to me, this is trying to cover up the people that where they were seeing the supposed cluster in Brazil. That is where they are spraying some of the worst pesticides, Tiffany. They were spraying these heavy duty pesticides in the drinking water, and they use pesticides like DDT, and pesticides we don't allow here are okay to use in this
right.
area of Brazil. And so these people, how can we say this is Zika? And from what
They,
go ahead.
it's just well, you can't believe them anymore. I mean, by the time we're done, I hope we put so much doubt or question in the public's mind that they will start going to either board meetings or start, I, I, I thought we were going to talk about pesticides, but here we go back to the money because it always goes to the money. San Joaquin County has two tax assessments on on a person. So if you own a home in San Joaquin County, there are two assessments that you pay for mosquito abatement. So they don't just have one assessment on your property tax; they have two. And but so that funds them pretty nice. Then they create a state of emergency, and of course it was West Nile, but then this greater, better virus came along called Zika, which is,
It's been around for decades and we've known about it. Rockefeller is the one that the Rockefellers own
well,
the
there you go,
patent.
right there.
Yeah, they own the patent on Zika. So, start connecting the dots. We have the
Check this out.
Rockefellers. We allocated 20 billion taxpayer dollars to create a vaccine against Zika when we have absolutely no scientific proof that it's any threat whatsoever, because people have been getting it, and when they get it, they don't even have any symptoms.
The Rockefellers are the threat, but I'm sorry because this is your radio show, and I'm
No,
starting to get
no, no.
my. But I was thinking about something. I was listening to your advertisements, and or actually it was the news that came on before your show. It was probably a couple episodes ago, and Monsanto was a big deal. People were really getting onto Monsanto for the herbicide, for Roundup, which is one of the mosquito abatement does not just spray pesticides. They spray herbicides, and they spray aquacultures. And so I was listening, and I didn't really put it together till after we hung up. But so now Bayer has bought Monsanto, and vector control uses Bayer products. So now when you say Monsanto, you say Bayer, you say Mosquito and Vector Control District.
And they're going to completely get rid of the Monsanto name because they know it's tainted. And so now we have to talk about the evil Bayer instead of the evil
Well,
Monsanto.
the thing is mosquito abatement does not just use Bayer. They use Wilbur Ellis. They off the top of my head, can't think of all the manufacturers they use, but Wilbur Ellis, our manager at Mosquito Abatement, his son is a distributor for Wilbur Ellis, so that's a big one that they use.
Is
I
that a U.S. company that makes pesticides? Do they make vaccines too?
I do not know. I do not. Don't know. Good question.
I'll look them up. Go ahead.
Good question. I wanted to show you something. I learned some very interesting information from my local for my local area, and I wanted to show you something. Last week we were talking about all the law firms that the district has, and we were kind of talking about you know kind of what I've been through, and we haven't even scratched the surface of what I've been through. But I just realized, this is our fourth interview, and I just realized that I'm actually, somebody can watch me. I didn't realize that I was on video. I realize I'm looking at a camera, but I don't see you, so it didn't click that I was being, like video recorded. So I wanted to show you something, if you wouldn't mind.
Your video should be up right now, so we're working on getting the video because I want to see what you're showing me, and I just realized that they didn't have the Skype up.
Oh, so that means that right now nobody can see me?
Right. So we're working on getting the video up. So
Okay.
we'll have it
we'll
up in just a couple minutes, and then you can show us.
Okay, so we have a farmer's market here.
Okay, there you are. There you are. We have you.
You can see me?
Yeah, now we can see you.
So the cost of living is pretty high at pretty much everywhere here in California. And so I rent a room, and so I have just one bedroom, and I had to decide with all of the things that I owned what I was going to keep and what was going to, what had to go. So I want to show you. Now I can't see you, so I'm just. Can you see me?
Yeah, I can see you.
Okay, so I don't know if you can see this. I don't know if you can see this box of documents here.
Uh-huh.
And then this box of documents, like this says West Nile Funds here, and then this box of documents here, box of documents, box of documents, box of documents, box of documents, all my journals, and these are all the documents that the opposing counsel has sent to me, or it's the evidence that I have to back up anything that we might talk about. But when we were talking about the 5 law firms, I just kind of wanted to give you a visual of what those 5 law firms do. And what they do is they send you a crud load of papers, and they just try and paper you to death.
Well, and just everyone, if you missed last week's show, what Tiffany's talking about is the San Joaquin Vector Department that she used to work for, that they have hired 5 different law firms. This is a Vector Department. And last week we were talking about how they evade reporting any kind of workman's comp accidents, exposures to pesticides by employees, that all of these things are kept hidden and channeled through the lawyers instead of the workman's comp, and no documentation or OSHA is brought in where they're supposed to be documenting these employees for 30 years after they quit working for the Vector Department. So what's really upsetting for me is that if they were really documenting things truthfully, we would have all kinds of proof on how harmful these pesticides are, but because they're hiding it. Do you
see the documents in my closet? I mean, there's proof right there. I mean, nobody, I thought, like, what do I do with these? Should I just take them to a board meeting one day and say, look, here's your papers back?
You said that you're still in contact with people that are working there. Has anything changed since you've been bringing all this to light and accusing them in public?
Nope. Nobody. Okay, there were about 5 people that they used to try to terminate me, and one was I was thinking a lot about this. One is the entomologist. The entomologist is the person who.
But why were they trying to terminate you?
Because I filed a grand jury complaint against them. It started with an altercation between 2 employees, and one employee assaulted a second employee. They were both supervisors, and what was happening was one supervisor was putting the district at severe liability. He was sleeping with his subordinate. They were out in the field. They'd come back with hickeys on their neck. Apparently, her husband was following employees around with a gun. He actually had went to our manager and told him that he was going to, um, you know, harm any of the vector control employees. And so the manager did not tell us employees, but he brought the supervisor and the female, he brought them in so they wouldn't get hurt and left us all out in the field. And so one employee he had the most tenure. He went to the manager and said, "Look, this guy is a liability." And this guy was doing more than just sleeping with a subordinate. During breaks, he would talk about anal sex. He would talk about oral sex. He would talk about bestiality. He would degrade employees. He should have been terminated. But what we didn't know was that he was participating in a conspiracy to spray the formaldehyde, and so they were just protecting him. And so he assaulted. The manager gave authority to the liability supervisor to go ahead and threaten the other employee, and it resulted in that employee being taken to the hospital and admitted with chest pains. He had a heart attack, and so this is how it all began. Workers' comp came in. They brought an investigator in. They interviewed all the employees. I was one of the employees they interviewed, and I refused to lie during the interview. I didn't like the guy who was assaulted and given a heart attack. Don't get me wrong, I really didn't like him, but I wasn't going to lie because I didn't like somebody. I wasn't going to twist facts around to cover anybody. I could already see that the manager.
So workman's comp came that time, and that was unusual because before they would never call workman's comp when anything happened.
Actually, workers' comp, they report some injuries, and workers' comp, it's I don't fully understand it, but like I had 3 exposures within my first year of employment, and what they do is they kind of like launder money through workers' comp. So they actually use the system, they just don't report the injuries to OSHA. So what happens is they I don't know, they make money off of their workers' comp. I know that sounds crazy, but they actually do report some injuries, not to OSHA, but to their workers' comp. They run the injury through that, and then their workers' comp attorneys make the injuries go away.
So how big is the budget for that vector department for a
I'd
year?
have to look. I know that they had, the last time I looked, which was probably 3 or 4 years ago, they had like an $8 billion surplus. And that was just
How much? 8 billion or 8 million?
I'm sorry, million. $8 million surplus.
$8 million surplus.
Surplus. And that's just our vector control. That's not all the joint. Remember, they're a joint power authority. So it's not just my vector control is not standing alone. There are on their self-insurance plan, there's multiple districts. I would have to look, Elaine. I knew all this stuff. I knew it really well, but I've been working on
it's okay, it's not important, but the bottom line is these people have all this money, but not just that. They're in charge of some of the most toxic substances on the planet. That's what you're in the business of. Using some of the most toxic substances we have on the planet.
Wasn't Roundup just sued?
Well, yeah, the state of California, we had it added to the Prop 65 list as cancer causing, and I don't even know what happened because they had went back to court again, and even though we had won to have it on the Prop 65 list, they were challenging, Monsanto was challenging in court that it was actually cancer causing. So they had to bring in all these scientists and this judge. One judge had to listen to all this testimony, which is like very technical for a
Well,
judge to and to make have him make the decision.
especially, well, first of all, in California, I just don't know, if I haven't seen a lot of honesty going around here. My point was Roundup is one product we use, one out of multiple products. I kind of wanted
How
to
do
get
you
in.
decide, like when you go to work and they give you like a work order? Okay, you're going to go. We need to go take care of this problem over in this area. How is that all figured out? I mean, where does the order come in for them to spray a certain area? Is that from the California pesticide department, the
No, it's
state?
from the manager at Mosquito and Vector Control District. The manager basically, okay, it's everything is seasonal. I'm going to tell you something right now because I want this ingrained in your mind and in the listener's mind. Mosquitoes are seasonal. Mosquitoes, um, they hibernate and they overwinter for, they come out when it's about 60 degrees outside. Um, and so think about how many months. Well, I know you're in Southern California, it might be a little different, but here in the valley, I mean, we actually have some really cold winters, and um, like our neighboring vector control district, their employees, their pesticide applicators are seasonal, and they work like 6, 7 months out of the year, and then they're laid off for 4 months, and they go on. They may work a lot of overtime during the season. I mean, we could work sometimes 7 days a week. When we start getting into the species of mosquito and the temperatures, that's what dictates that, and water is those are that's what dictates when the mosquitoes come out and how they breed. And but so 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 the manager is the one who calls all the shots, period. And he's supposed to, like in San Joaquin County, we're broken up into three sections. We have the southern, central, and the northern. So we have three territories, and so there's three supervisors. And so then in the southern area, they changed their areas, but there used to be 19 zones, and so there was one zone operator for each zone, and every zone is different. Like when I first began, my first year I was out in Linden, and Linden was predominantly it would be like snow melt. Um, it would be orchards, and I had I had a water district, and I had a one sewer plant, and I was out there for only 1 year, and they called it the slipper zone because they said that you never had to take your never had to take your shoes off. You could just wear your slippers in that zone. And when I first got hired, the assistant manager who assigned me that area, he said, I'd really like you to stay here because I mean it takes a while to learn the chemicals. It takes a while to learn territories. It takes a while to learn sources, and so you got your species of mosquitoes, your chemicals, your territories.
I guess I'm wondering how the decision process
Oh,
happens because I guess they have to diagnose, they have to catch certain insects, but I still feel confused. I could see like, okay, it rained, and and I don't even hear any warnings on the news, to get rid of standing water, that kind of thing. I feel like there's no prevention that happens around here,
absolutely.
and
Absolutely.
same there. They're not trying to use any prevention messages to stop the need.
Oh, they use a lot. Like we have a PR guy. In fact, when they tried to force me out of my job, I asked, I could no longer do the job that they hired me for because I'd had 3 knee surgeries, which were intentionally induced on me. The person who had my position, the position they had put me in, the guy had gone out on a knee injury and he could not return to his job, and they put me in his position knowing that I would get hurt, and then but so we have a great PR program. They put a lot of money into it, and you know, we're our district is all about looks. It's all about perception. It's all about shiny trucks, really cute, good-looking people, and to be seen, and definitely not heard for sure. But
Because they're trying to give this impression, we're here for you, we're protecting you,
right,
we're
right, which
helping you.
yeah, that is further from the truth. Um, they're helping themselves for sure. I was thinking a lot about this today. Like, where were we going to go? And I wish my job description would have said, "Come to work, put makeup on, be cute, don't ask questions." Because I really took my job seriously. I would read books about mosquitoes, and I on my own time at home. I would research my job because I really wanted to know what I was doing, and I really, I felt important, and I felt like I was, like I was really protecting the public. And the more that I knew, um,
Did you notice things dying like as a result of you spraying that were unintended to be dying? I mean, when you go out and spray these pesticides, did you see things as a result of using these pesticides that you felt were disturbing?
well, absolutely. I mean, first of all, I mean, we would spray herbicides, and so we were intentionally going out and killing. Let me see if I can get the terminology right. There, we have the one herbicide that would kill the stems. It's systemic, and then we had I don't think I'm going to be able to come up with the other term. The other one would
It was more of a foliage.
yes, exactly. So we had 2 different kinds, and so we would intentionally go onto people's property without telling them, and we would spray these herbicides. In fact, they've had to buy somebody's vineyard before because of drift. So, but yes, fish. The biggest thing was fish. But if you okay, this is a great segue into methoprene. I don't know how much more time we have, but
We have
oh,
10 minutes.
cool. Okay. So I went to my local farmers market on Thursday. Every Thursday we have a farmers market. And so the city of Lodi happened to be there with their booth. And so I don't know, I just love going and talking to people, and just so I went up to their booth, and they had this spin a wheel, and it had numbers on it, and then whatever number you got, they asked you a question. And I mean, I was cheating because I have a lot of knowledge because of my job. So they were water questions, and when they were done asking me the questions, I started asking them questions. And there's a product that we use called methoprene, or Alticid is the like the name, like the brand name, and methoprene is the chemical compound. And so methoprene is a hormone growth regulator, something that we used um, during the season. We could use it daily. We used it in so many different places. And methoprene it has a residual, which means depending on the size of it, it could last from a month to 4 to 6 months. So there's one called methoprene XR, and it's like 120 days. So 30, 60, 90, 100, yeah, 4 months. So do you know what a catch basin is?
No.
A storm drain.
Oh,
Okay.
okay. Yeah.
Okay. So
Yeah, we have
so
those.
in our storm drains, um, they they catch water, they hold water, And so one of our biggest jobs
Is that
was,
like a levee?
no, the storm drains are like, okay, so when I used to call it touch the bases because that was the job that we'd have to do. But if you go to an intersection and you look at the four corners, there's a storm drain that catches rainwater.
Okay.
Or, okay, or your gut, or like if you're washing your car, your gutter water goes in there. So we would put we would put either BTI in there, which is a bacteria, or we would put this methoprene, the hormone growth regulator, and we would do this in the towns, Stockton, Lodi, um, Tracy, but now I can only speak for Lodi. This is like new information that I just got last week that was mind blowing. I asked the people that were sitting at the table, I said, where do you dump your storm water? Because we've treated Stockton before with this methoprene, and right after we treated it, the city dumped it. Now I don't know where the city of Stockton dumps their rainwater, but apparently I just learned last Thursday that the city of Lodi dumps theirs in the McCallum River. So so we swim in the McCallum River, and our fish is in the McCallum River. And what they told me, and I have to go do a tour. I have to go check this out because this doesn't make sense to me. But they're taking this chemical, the storm drain water that we put this methoprene in, and they're dumping that into the McCallum River, and then apparently that's what they're giving us to drink and shower with.
And is that harmful to amphibians as well?
Uh,
That
you know,
methoprene?
I would say their lawyers have done a really good job of covering up what the real effects of methoprene does, but there is a study on the frogs and deformation. If you put in methoprene in frogs, I'm sure that you could find some literature, and if not, I can shoot you some. I'm not a scientist. I don't know, but I know what it did to me. The methoprene specifically, um, when I began menstruating so bad that I would bleed through my clothes. And so then I went to my
Because it
gynecologist.
is a hormone
It grows.
disruptor.
Yes. What it does to the mosquito is that when the larva eats, when you put it in the water, the larva eats it. Um, its guts explode. So it doesn't hatch. It doesn't go through the metamorphosis cycle. So so that's what it does to the larva. Now for me, then after I was having these heavy menstrual cycles, and then all this, then the gynecologist, and I was having really bad cramping, heavy cramping, and the gynecologist did an ultrasound on me and a biopsy. They did a biopsy. I had benign tumor, and at that point, I had my eggs were drying up, and so I will, I what ended up happening was within probably 1 year, I stopped having periods, and I haven't had a menstrual cycle since. So that's what it did to me. I don't know what it does to frogs.
It says it mimics the natural juvenile hormone uh, absent for a pupae to molt to an adult. So methoprene treated larvae will be unable to successfully change from pupae to adults.
Right, right. Isn't that what I said? Kind of.
Yeah.
Yeah.
Yeah, it's a hormone disruptor.
Right.
So it's affecting their ability to reproduce.
So what I'm finding pretty alarming is, okay, it's one thing to have a certified pesticide applicator go put it in a benign place, like like one of the things we would treat would be cemetery urns. And okay, so there's dead people there at the cemetery, so you do have to worry about the family member who comes in contact with it and is emptying the water out to put fresh flowers in for their loved one. But what was really mind blowing to me was this information I just got last week, where they're taking this chemical and dumping it into our McCalmy River where people are swimming, and then our water facility is right there, and they're putting it in our drinking water. I mean, I need to go double
Well,
check with
it says that it's highly toxic to freshwater invertebrates. It also appears as well. It says low toxicity to adult bees, but it's in the water,
yeah.
and
Bees aren't going to have as much it's not the bees that you got to worry about. It would be the fish. It'd be
right.
human. It's always baffling to me. I remember when, like when I was trying to get the grand jury's attention, for what was going on with me, um, somebody told me, if it harms an animal, then you will get somebody's attention. But, if it's hazardous to a human, people probably won't care. And it's like, what?
I know that doesn't make sense, does it?
No.
Oh, darn, we're out of time. But I again, we got into it even more this time. I'm going to be putting all these interviews together in one place, everyone, so we can really start to evaluate all these different things that we've learned from Tiffany. I want to make a long list of all the things that we need to be thinking about, because this is a place where billions of dollars are being spent to poison us versus being spent on something like universal health care where it keeps us alive.
Or
And so,
clean water.
yeah, and our environment for our children. So thank you so much, Tiffany. And this is, I'm Elaine McFadden, your host from Smart Health Talk. And please come back and join us and go to our BlueMonarchProject.com, and our plant sale is here every Sunday from 11 to 5. So please come and visit us on Sunday. I will be here with lots of other new plants. And thanks so much for tuning in. And thank you, Tiffany.
Thank you, Elaine. Thank you so much.
Okay. All right. Thanks, everyone, for tuning in. This is KCAA Radio and Smart Health Talk.